Most men after 50 eat foods every day that slowly weaken prostate health. You will not feel it early. There is no sharp pain. But inside your body, pressure is building. I am Dr. Ross. In this video, you will learn how daily food choices affect your prostate and how to notice early warning signs before things get worse. If you care about your health, follow this channel for clear medical guidance. There is one common mistake many men make. It feels normal, so it gets ignored. Over time, that mistake leads to weak urine flow, poor sleep, and constant bathroom trips at night. The prostate sits just below your bladder. It wraps around the tube that carries urine out of your body. When this small gland becomes irritated or enlarged, it presses on that tube. That pressure changes how urine flows. Food plays a direct role in this process. What you eat affects inflammation, hormone balance, and blood flow. These changes do not happen overnight. They build slowly. That is why many men miss the early stage. At first, everything feels fine. You go about your day, you eat what you like, but inside your body, small changes begin. The prostate starts reacting to repeated stress from diet patterns. Over time, that reaction becomes swelling. When swelling begins, urine flow starts to change. Not suddenly, gradually. Wait, pay close attention. Your body gives early signals. Most men ignore them. You may notice your urine stream feels weaker than before. It does not come out with the same force. You may stand there longer, waiting for it to start. That delay is not random. It shows pressure building around the urinary passage. You may start waking up at night to urinate. At first, once per night. Then it becomes more frequent. Your sleep becomes lighter. You wake up tired. You may feel like your bladder is not fully empty. Even after urinating, there is still a sensation left. That feeling is not in your head. It comes from pressure inside the prostate area. Some men notice mild discomfort in the lower abdomen or pelvic area, especially after heavy meals. This is another early sign that something is changing. These symptoms do not appear all at once. They come slowly. That is why they are easy to ignore. Now focus on this. Your daily food choices play a major role in these changes. First, processed meat products. Sausages, bacon, and cured meats contain high levels of sodium and preservatives. When you eat these foods often, they increase inflammation inside your body. That inflammation does not stay in one place. It affects sensitive areas, including the prostate. Over time, this leads to swelling. That swelling creates pressure on your urinary passage. Second, deep-fried meals. Fried chicken, fried snacks, and fast food meals contain unhealthy fats. These fats affect blood flow and hormone balance. Poor circulation in the pelvic region slows down recovery inside prostate tissue. When blood flow drops, tissue health drops. This makes the prostate more sensitive to irritation. Third, high dairy intake. Full-fat milk, cheese, and cream-based foods influence hormone levels in your body. In some men, this creates an imbalance that affects prostate function. When hormone signals shift, prostate tissue can respond with growth or irritation. This adds pressure over time. Fourth, sugary drinks. Soft drinks and sweetened beverages cause repeated spikes in blood sugar. These spikes lead to higher insulin levels. High insulin increases inflammation across body systems. The prostate reacts slowly, but repeated exposure builds long-term stress. Fifth, excessive red meat consumption. Large portions of beef, especially when eaten frequently, increase metabolic load. Your body works harder to process it. This creates internal stress and waste buildup. When the system is under constant pressure, the urinary tract feels the effect. None of these foods cause instant damage. The danger comes from repetition. When you eat these foods daily or in large amounts, the effect adds up. The prostate responds slowly but consistently. This is why many men feel fine for years. Then suddenly, symptoms appear. It is not sudden. It has been building. Most men think prostate problems start with age alone. That is not accurate. Diet pattern plays a major role long before symptoms begin. If you ignore early signs, pressure continues to build. Urine flow becomes weaker. Night urination increases. Bladder strain grows. You start adjusting your routine without realizing it. You avoid drinking water at night. You plan your day around bathroom access. This is how it begins. Now think about this. Have you noticed any change in your urine flow? Do you wake up at night more than before? Do you feel like your bladder is not fully empty? These are not random changes. Many men wait until symptoms become severe before taking action. By then, the prostate has already changed. Early awareness gives you control. Let me make this clear. Night urination is not always normal aging. Weak urine stream is not something to ignore. Delay before urination is a sign of pressure. That feeling of incomplete emptying is real. These are early warnings. Your body is telling you something is changing. And in many cases, your daily food choices are part of the cause. Small habits repeated every day create long-term results. If you continue the same pattern, the condition progresses. If you change the pattern early, you reduce risk. This is where many men get it wrong. They wait. They hope it improves on its own. But prostate changes do not reverse without action. The longer you wait, the more pressure builds inside the urinary system. And when that happens, simple steps are no longer enough. Next section explains what helps reduce this risk, what doctors check first, and the steps used in clinical practice to manage and control these changes before they become serious. This is where many men get it wrong. You notice small changes. You adjust your routine. You drink less water at night. You ignore the weak flow. You tell yourself it is normal. That delay allows the condition to grow. When prostate pressure increases, the urinary pathway becomes narrower. The bladder works harder to push urine out. Over time, the bladder muscle becomes strained. This is why early action matters. So what do doctors check first? The first step is always your symptoms. You will be asked simple questions. How many times do you wake up at night to urinate? Has your urine flow become weaker? Do you feel delay before urine starts? Do you feel like your bladder is not fully empty? These questions are not random. They help measure how much pressure exists inside the urinary system. Next comes physical assessment. A clinical exam helps check prostate size and texture. Enlargement gives one level of concern. Hardness or irregular shape gives another. This step helps guide the next decision. After that, basic tests are done. A blood test checks prostate-specific antigen. This marker helps detect abnormal activity inside prostate tissue. A higher level does not always mean a serious condition, but it signals the need for closer evaluation. Urine testing follows. This helps rule out infection. Infection can cause similar symptoms like burning, frequency, and urgency. If infection is present, treatment path changes completely. Now here's something many men do not expect. Imaging may be used early in some cases. An ultrasound checks how well your bladder empties. After you urinate, the machine measures how much urine remains. This is called residual urine. If a large amount remains, it shows your bladder is under strain. It also shows there is obstruction in the urinary pathway. Pay attention to this. The longer urine stays inside the bladder, the higher the risk of further complications. Now let's talk about risk progression. If pressure inside the prostate continues, urine flow becomes weaker. The bladder works harder. Over time, the bladder muscle loses strength. This leads to more frequent urination, even when the bladder is not full. You may feel urgency. You may rush to the bathroom. In some cases, leakage begins. This is why delay is dangerous. Now, here is what helps most. The first step is not medication. It is correction of daily habits. Food adjustment comes first. Reducing processed meat lowers sodium load. This reduces fluid retention around prostate tissue. Reducing fried food improves blood circulation. Better blood flow supports tissue recovery. Reducing sugary drinks stabilizes insulin levels. Lower insulin reduces inflammation inside the body. Reducing heavy dairy intake helps in cases where hormone sensitivity affects prostate tissue. Reducing red meat portions lowers metabolic stress on your system. These changes may sound simple, but they have strong effect over time. Next is hydration control. You need steady water intake during the day. Not too little, not excessive. Low water intake leads to concentrated urine. Concentrated urine irritates the bladder lining. High intake late at night increases night urination. Balance is key. Spread your water intake across the day. Reduce intake close to bedtime. Now let's talk about bladder training. Your bladder responds to habit. If you rush to urinate every time you feel a slight urge, your bladder becomes more sensitive. You need to train it. Try to delay urination slightly when safe. This builds bladder control. Set a schedule. Go to the bathroom at regular intervals instead of reacting to every urge. This improves bladder strength over time. Pelvic muscle support also matters. Simple pelvic exercises improve control over urine flow. Stronger muscles support better bladder function. Now, when do doctors introduce medication? When symptoms begin to affect daily life. If weak flow becomes consistent, if night urination disrupts sleep, or if bladder strain increases, medication is considered. One common group of medication relaxes muscles around the prostate. When these muscles relax, the urinary pathway opens slightly. This improves urine flow. Another group works on reducing prostate size over time. These medications affect hormone activity linked with prostate growth. Effect takes time, but it helps reduce long-term pressure. Monitoring is important. Doctors track your progress. Night urination frequency shows improvement level. Flow strength shows response. Residual urine shows bladder recovery. If improvement is seen, treatment continues. If not, adjustment is made. Many men believe supplements alone will fix the problem. This is not accurate. Supplements may support health, but they do not replace proper evaluation and treatment. Relying only on supplements while ignoring symptoms delays proper care. Another mistake is stopping treatment early. Some men feel slight improvement and stop medication or lifestyle changes. The condition returns. Consistency matters. Now consider lifestyle factors beyond food. Physical activity plays a role. Regular movement improves circulation. Better circulation supports prostate health. Long hours of sitting increase pressure in the pelvic area. This worsens symptoms. You need movement during the day. Even short walks help. Weight control is also important. Excess body fat affects hormone balance. Hormonal imbalance influences prostate growth. Reducing weight helps improve symptoms over time. Stress also affects urinary function. High stress increases muscle tension around the bladder outlet. This makes urination more difficult. You need to manage stress through simple routines. Deep breathing, rest, and proper sleep help. Sleep quality matters. Poor sleep increases stress hormones. These hormones affect bladder function. Better sleep improves overall recovery. Now let's talk about advanced steps. If symptoms continue despite treatment, further evaluation is needed. Imaging gives more detail. In some cases, a small camera is used to look inside the urinary pathway. This helps identify blockage level. When obstruction becomes severe, procedural treatment is considered. These procedures remove or reduce excess prostate tissue, blocking urine flow. They are done with precision and aim to restore normal flow. But here is the key point. Most men do not need this stage if they act early. Early action prevents progression. Now think about your current situation. Are you noticing early signs? Are you adjusting your life instead of fixing the cause? These questions matter because the longer you wait, the more the condition builds. And when it builds, treatment becomes more complex. Men who act early have better outcomes. Men who delay often require longer treatment and more steps. That is the difference. So pay attention. Your body already gives signals. Your job is to respond early. Next section focuses on final prevention steps, long-term protection habits, and clear warning signs that require immediate medical attention. Most men think once symptoms start, the process cannot be controlled. That belief leads to delay. The truth is different. What you do daily from this point determines whether the condition stabilizes or keeps getting worse. You are now at the stage where your actions matter most. Prevention is no longer about avoiding the problem. It is about stopping progression and protecting what still works. Start with one clear principle. Consistency beats intensity. You do not need extreme changes. You need steady habits repeated every day. First, build a structured eating routine. Irregular eating patterns stress your system. Late heavy meals increase pressure during the night. Large portions stretch the digestive system and affect nearby organs, including the bladder and prostate area. You need smaller, balanced meals spaced through the day. Your last meal should be lighter. This reduces night pressure and helps improve sleep quality. Next, focus on fluid control with precision. Earlier, you learned hydration matters. Now you need control. Drink enough water during the day to keep urine light in color. This shows proper hydration. But reduce fluid intake 2 to 3 hours before sleep. This lowers night urination frequency. Avoid using thirst alone as your guide. Build a routine. Drink at regular intervals. Now pay attention to bladder habits. Do not wait too long before urinating. Holding urine for extended periods stretches the bladder. Over time, this weakens bladder function. At the same time, do not rush to the bathroom at every slight urge. That creates sensitivity. You need balance. Empty your bladder when needed, but avoid extremes. Now let's talk about posture and daily movement. Long sitting periods increase pressure in the pelvic region. This pressure affects circulation and adds stress to the urinary system. If you sit for work, break it every hour. Stand up. Walk for a few minutes. Simple movement improves blood flow. Better circulation supports tissue health. Walking remains one of the most effective habits. It supports weight control, circulation, and stress reduction at the same time. Now consider body weight. Excess weight adds internal pressure. It also affects hormone levels. These hormonal changes influence prostate growth. Gradual weight control reduces this pressure. You do not need rapid change. Even small weight loss improves urinary comfort. Now let's address one area many men ignore: bowel health. Constipation increases pressure in the pelvic area. A full bowel presses against the bladder and prostate region. This worsens urinary symptoms. You need regular bowel movement. Fiber intake supports this. Vegetables, fruits, and whole foods improve digestion and reduce strain. Now pay attention to caffeine and alcohol. Both affect bladder behavior. Caffeine increases urine production and irritates the bladder. Alcohol relaxes bladder control and increases frequency. If you notice symptoms getting worse after taking these, reduce intake. This is not about complete restriction. It is about control. Now let's move to warning signs that require immediate action. Do not ignore these. If you notice blood in your urine, seek medical attention immediately. This is not a normal change. If you are unable to urinate despite feeling full, this is an emergency. It shows severe blockage. If you feel strong pain in the lower abdomen along with difficulty urinating, this needs urgent care. If you develop fever with urinary symptoms, infection may be present. This requires prompt treatment. If leakage starts or control becomes difficult, it shows advanced strain on the bladder. These signs should not be delayed. Now think about monitoring your condition. You need awareness. Track your night urination frequency. Notice changes in flow strength. Pay attention to delay before urination. Observe how your body responds to daily habits. These small observations give early signals. Do not wait for severe discomfort. Act when changes are still mild. Now let's talk about long-term protection. Protection means maintaining control even after symptoms improve. Many men make this mistake. They feel better and return to old habits. The condition returns. You need to maintain discipline even after improvement. Maintain hydration routine. Stay active daily. Keep weight under control. Attend regular checkups. This is how you protect your progress. Now consider mental approach. Fear alone does not help. Awareness does. You are not trying to avoid life. You are managing your health. Small daily actions create long-term stability. Now let's bring everything together. Your prostate responds to pressure over time. That pressure comes from diet, lifestyle, and delayed action. You already know the early signs. You understand how the condition develops. You know what steps reduce risk. Now you have the tools to protect yourself long-term. The only thing left is action. Let me ask you directly. Will you wait until symptoms control your routine? Or will you take control while you still have the chance? Most men wait too long. That is the mistake. Watch for the signs, act early, stay consistent. This video is for educational purposes only and does not replace a consultation with a qualified doctor. If you want simple, clear medical guidance like this, subscribe and stay informed.